Okay, hey guys. This is more for like a nursing video, just to let you know and be aware, um, before you begin to watch, just in case you're not interested. But I'm trying to help myself study, and I decided to go ahead and maybe I should do things like this to help myself study and put things out there, because when I tried to find a video on it to help me study, I couldn't find much on it, on the subject. So I was like, why not make one myself? But at the same time, um, I'm just going to be stating what I have until I learn some more on it. But today's video is going to be on haloperidol, Haldol, which is a drug, antipsychotic drug, and its action states that it's a first generation antipsychotic that blocks receptors for dopamine within the central nervous system as well as outside the central nervous system. So dopamine, um, that's something serious. I know it deals with I believe it deals with obsession. I'll have to look that back up again. Um, hmm. Basically, haloperidol is used for schizophrenia, which is something I'm studying, acute psychosis, Tourette syndrome, and also sedation of patients who are severely agitated. So, uses are schizophrenia, acute psychosis, and Tourette syndrome, and sedation of patients who are very agitated. Okay. Precautions with this medicine, and some contraindications are with Parkinson's disease, because it will counteract the effectiveness of the Parkinson's medications and increase the symptoms. Um, central nervous depression, central nervous system depression, narrow angle glaucoma, severe cardiac and hepatic disease. Okay, so side effects are the extrapyramidal reactions, which are tardive dyskinesia, that is late twisting movement of the face and the tongue, lip smacking, Parkinsonism, Parkinsonism, which is bradykinesia, mask-like faces. I believe you say that. I don't know if that's correct, but drooling, tremor, and gait problems. Um, Also acute dystonia, spasms of the tongue, face, neck, and back. Akathisia, if I'm saying that correctly, compulsive restless movement, anxiety, and agitation. Okay, so those are extra pyramidal reactions. Tardive dyskinesia, the late twisting movement of face and tongue, the lip smacking. Parkinsonism, bradykinesia, mask-like faces, drooling, tremor, gait problems, acute dystonia, spasms of the tongue, face, neck, and back. Akathisia, compulsive restless movement, anxiety, agitation. The serious, most life-threatening effect of the haloperidol is NMS, which is neuroleptic malignant syndrome. It's rare but serious. The anticholinergic effects, which are drowsiness, dry mouth, constipation, urinary retention. So anticholinergic effects usually you have a dry mouth, um, because they give you the dry mouth and the drowsiness, and the constipation, which are the main symptoms when using anticholinergics. And this one says urinary retention. So the QT changes and the potential for dysrhythmias, and that is also a serious life-threatening event. So with Haldol, the two most serious life-threatening events are NMS, the neuroleptic malignant syndrome, and the dysrhythmias. The rest are just the most frequent side effects, which are the tardive dyskinesia, Parkinsonism, acute dystonia, akathisia, anticholinergic effects, and the QT changes. So the nursing implication or interventions are basically what you should do as a nurse are basically frequently monitor patient for reduction of target symptoms, which is basically you're giving them this medicine to reduce their psychotic symptoms. So you want to monitor it and make sure that the symptoms that they're having are being reduced, because it shows that the medicine is working or having some type of effect and being therapeutic. Um, Routinely assess for presence of involuntary movement, because that is, that lets you know that some of the side effects are occurring. And I definitely have to look up more on neuroleptic malignant syndrome, because I feel like that has something to do with it. But just basically look for involuntary movement, because I believe that's a bad sign. Of course. Provide family and patient education. So you teach the family so that they know how to deal with it, they know what to do, and when to, pretty much contact the doctor. And poor adherence is the common cause of therapeutic failure. So they have to keep up with their medicine, keep up with whatever they were taught to do with this medicine, because if they don't, they can have negative effects, and it won't be, therapeutic for them. But that's basically what I have on the Haldol, the Haloperidol, right now, it's just an overview. But this was just to help me study, and I'm going to make more nursing videos for you nurses that are out there, well, nurses to be like me, and hopefully we can help each other. Thank you for watching. Goodbye.